Welcome to Module 43 of the Legacy Holistic Health Coach Training Program. In this module, we're going to be talking a little bit about what cancer is, understanding the different cancer types and how to properly go through the steps of diagnosis, and how to discover the different types of treatments available for people with cancer. So, the word for this particular module is cure. All too often, we hear about people who have either gone through a journey with cancer or people who have family members that have had to take a journey with cancer and being diagnosed and subsequently treated as a result. Our goal in this module is to do two things. Number one, expose the student to what cancer is and the different types of cancer that are happening today. And then number two, to help the student understand the process that people who are diagnosed with or who have family members diagnosed with cancer go through each time this happens. So collectively, this module will give you a perspective on the journey that people have when they hear the word cancer and what comes up next for them, and some of the things to be aware of should they approach you for health coaching. So cancer is, according to the National Cancer Institute, it's a name given to a collection of related diseases. In all types of cancers, some of the body's cells begin to divide without stopping and spread into surrounding tissues. Now, cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and divide to form new cells as the body needs them. When cells grow old and they become damaged, typically they're supposed to die off and new cells are supposed to grow and take their place. However, when cancer develops, this orderly process breaks down and it simply doesn't happen in this smooth, orderly fashion. As cells become more and more abnormal, old or damaged cells survive when they should actually die off, and new cells form when they are really not needed. These extra cells can happen based on what a person eats and the information that they give their body. It can also develop from emotions, trauma, pent-up energy, and different things that are happening in the person's personal life that causes physical stress on the body as well. These extra cells can divide without stopping and may form growths called tumors. A few quick facts that you want to be aware of when it comes to cancer. Understand that unlike malignant tumors, benign tumors do not spread into or invade nearby tissues, but benign tumors can sometimes be quite large. When they're removed, they usually don't grow back, whereas things that are malignant sometimes do grow back. Unlike most benign tumors elsewhere in the body, benign brain tumors can be life-threatening. Now that we understand some quick facts about cancer, things that are benign are things that are not harmful and they're not cancerous and they don't spread like wildfire. They are just an overgrowth of cells that show up as a tumor that can then be removed altogether in one unit and never grow back. When it comes to something that is cancerous or malignant, so it can either be benign, which is non-harmful, or it can be malignant, which is malicious or harmful to the body. Now, if something is malignant, it has the tendency to spread and can typically spread very rapidly. And so when something is malignant, that is when it is considered to be called something cancerous. And at that point, it's time to look at removing it and stopping it with some of the treatments we're going to be talking about in this module. Before we talk about any types of treatments or the journey, let's understand a little bit deeper what's happening with cancerous cells versus normal cells. Now, cancer cells differ from normal cells in many ways that allow them to grow out of control and simply become very invasive. One important difference is that cancer cells are less specialized than normal cells. That is, whereas normal cells mature into very distinct cell types and very specific functions they have, cancer cells don't. This is one reason that, unlike normal cells, cancer cells continue to just divide without really ever stopping. This is the key to something becoming malicious or malignant in the body. Additionally, cancer cells are able to ignore signals that normally tell cells to stop dividing, or that begin the process which is known as normal programmed cell death for cells that are no longer needed. Now, this process is typically called apoptosis, and it is normal for cells to go through their life course and then die off, and new, fresh, healthy cells to take their place, which the body needs or uses to get rid of unneeded cells. Cancer cells may be able to influence the normal cells, molecules, and the blood vessels that surround and feed a tumor. An area known as the microenvironment is the area that's around a tumor. For example, cancer cells can induce nearby normal cells to form blood vessels that supply tumors with oxygen and nutrients to keep growing. These blood vessels also remove waste products from the tumors. This keeps tumors from being malignant and malicious in the body. Cancer cells also often are able to invade the immune system. So when the immune system knows that cells that are supposed to die off are not supposed to be in the body, they typically go through a process that then begins to naturally rid the body of those cells. When it comes to cancer, this process doesn't happen because cancer cells have the ability to evade or hide from the normal immune response. Now, remember, the immune system is a network of organs, tissues, and specialized cells that protect the body from infections and other conditions. Now, although the immune system normally removes damaged or abnormal cells from the body, some cancer cells are able to hide from the immune system. Tumors can also use the immune system to stay alive and grow. For example, with the help of certain immune system cells that normally prevent a runaway immune response, cancer cells can keep the immune system from killing these cancer cells. So cancer can be very sophisticated in the way that it hides, in the way that it spreads, and in the way that it becomes malignant in the body. Now that we understand a little bit about the differences between the different cancer cell makeup versus normal cells, and we know that cancer cells can evade the immune system, they can create their own blood supply to nourish tumors and continue to allow them to grow. And we now know that normal cells, or the normal cell death process called apoptosis, doesn't happen, and that's the reason why we have so many extra cells hanging around in the body to form cancer. Now that we understand this process, let's take a look at some different cancer types and what can actually form or happen when these cells are left around in the body. So, there are more than 100 types of cancer. Types of cancer are usually named for the organs or tissues where the cancers are formed. So endometrial cancer, lung cancer, uterine cancer, different places in the body where the cancer forms is the different types of names of cancer. So there are hundreds of different types of cancer out there. Lung cancer starts in the cells of the lungs. Brain cancer starts in the cells of the brain. Cancers also may be described by the type of cell that formed them, such as epithelial cell or the squamous cell. Here, we're going to discuss some different types of cancer and that begin and how they actually come about. So, carcinoma is the most common type of cancer. This is formed by epithelial cells, which are the cells that cover the inside and outside surfaces of the body. There are many types of epithelial cells, which often have a column-like shape when viewed under a microscope. Carcinomas that begin in different epithelial cell types have specific names. For example, adenocarcinoma is a cancer that forms in the epithelial tissues that produce fluid or mucus. Tissues with this type of epithelial cells are sometimes called glandular tissues. Most cancers of the breast, colon, prostate are all adenocarcinomas. Basal cell carcinoma is a cancer that begins in the lower or basal level layer of the epidermis. Now, this is the person's outer layer of the skin. Now, squamous cell carcinoma is a form that forms in the squamous cells. These are the epithelial cells that lie just beneath the outer surface of the skin. Squamous cells are also line many of the organs, including the stomach, the intestines, the lungs, the bladder, and even the kidneys. Squamous cells look flat, like fish scales, when viewed under a microscope. Squamous cell carcinoma are sometimes called epidermoid carcinomas. Now, transitional cell carcinoma is cancer that forms in a type of epithelial tissue called transitional epithelium or urothelium. This tissue, which is made up of many layers of epithelial cells that can get bigger or smaller, is found in the lining of places like the bladder, the uterus, and even in parts of the kidneys or the renal pelvis, and a few other organs. Some of these types of cancers of the bladder, uterus, and kidneys are transitional cell carcinomas. There are more than 100 different types of cancer, so keep that in mind. And the types of cancer are usually named for the organs that the cancer forms in. Now, sarcoma is a soft tissue. Sarcoma forms in soft tissue of the body, including muscles, tendons, fat, blood vessels, lymph vessels, nerves, and tissue around the joints. Sarcomas are carcinomas that form in bone and soft tissues, including muscles, fat, lymph, vessels, fibrous tissue, and tendons and ligaments. Osteosarcoma is the most common cancer that is a type of sarcoma, and it's in the bone. The most common types of soft tissue sarcoma are leiomyosarcoma, Kaposi sarcoma, which is usually found in HIV and AIDS victims, and malignant fibrous histiocytoma, liposarcoma, and dermatofibrosarcoma. Now, leukemia is a type of cancer that begins in the blood, forming tissue of the bone marrow, and these cancers do not form solid tumors at all. Instead, large numbers of abnormal white blood cells, which is why it's called leukemia or leukemia cells or leukemic blast cells, build up in the blood and bone marrow, crowding out normal blood cells. The low level of normal blood cells can make it hard for the body to get oxygen to its tissues, control bleeding, and even fight infections. Now, there are 4 different types of leukemia, which are grouped based on how quickly the disease gets worse, acute or chronic, and on the type of blood cell the cancer starts in. Lymphoma is the most prevalent type of leukemia out there, and it begins in the lymphocytes or T cells and B cells. These are disease-fighting white blood cells that are part of the immune system. And in lymphoma, abnormal lymphocytes build up in lymph nodes and lymph vessels, as well as in other organs of the body. Now, there are 2 types of lymphoma out there, and the first one is Hodgkin's lymphoma, which most people are familiar with. And people with this disease type have abnormal lymphocytes that are called Reed-Sternberg cells. These cells usually form from B cells. And then there's non-Hodgkin's lymphoma. And this is a large group of cancers that start in the lymphocytes. The cancers can grow quickly or slowly and can form from B cells and T cells. Another form of leukemia is called multiple myeloma. And it's a type of cancer that begins in cells that become melanocytes, which are specialized cells that make melanin, which is the pigment that gives skin its color. Most melanomas form on the skin, but melanomas can also form in other pigmented tissues, such as the eye. Now, brain and spinal cord tumors are also named on the type of cells in which they form. There are different types of brain and spinal cord tumors, and these tumors are named based on the type of cells in which they form and where the tumor first forms in the central nervous system. For example, astrocytic tumor begins in star-shaped brain cells called astrocytes, which help keep nerve cells healthy. Brain tumors can be benign, which are non-cancerous, or they can also be malignant. Other types of tumors that we'll cover in this particular module are called germ cell tumors, And germ cell tumors are a type of tumor that begins in the cells that give rise to sperm or eggs. These tumors can occur almost anywhere in the body and can be either benign or malignant. Neuroendocrine tumors form from cells that release hormones in the blood in response to the signals from the nervous system. Now, these tumors, which may make higher than normal amounts of hormones, can cause many different types of symptoms. Neuroendocrine tumors may be benign or malignant. Now, carcinoid tumors are a type of tumor of the neuroendocrine system. Now, they are slow growing tumors that are usually found in the gastrointestinal system. And most often these are found in the rectum and the small intestine. Carcinoid tumors may spread to the liver or other sites in the body, and they may secrete substances such as serotonin or prostaglandins, which causes something called carcinoid syndrome. Now that we've taken a brief look at the different types of cancers, for the sake of time, obviously there's hundreds of different types of cancers out there, but for the sake of time, we're only going to go over these few types. Now that we understand the different types, let's take a step-by-step approach to how to actually diagnose or what happens when it comes to the diagnosis process. Okay, so when it comes to the diagnosis process, the one thing we want to make sure we look at is the different things that are happening. So in step one, in most cases, a doctor needs to do a biopsy or surgery to remove cells or tissue for examination under a microscope. This is what we call the tissue sample stage. In most cases, a doctor needs to do a biopsy or surgery to remove cells or tissues for examination. And so some common ways a biopsy can be done are with a needle used to withdraw tissue or fluid, an endoscope, which is a thin, lighted tube, and it's used to look in areas inside the body and remove cell tissues like the colon or the throat and things like that. Surgery is used to remove parts of a tumor or the entire tumor. If the entire tumor is removed, typically some normal tissue around the tumor is also removed just to make sure that they got all of it out. Now, before any of this happens, usually a person has some kinds of symptoms that lead them to believe that something is wrong and that they need to go and see a doctor. And at that point, the diagnosis steps begin to happen. Tissue removed during a biopsy is sent to a lab for pathology, which is sliced into thin sections for viewing under a microscope. Okay. The tissue removed during a biopsy or surgery may be cut into thin sections, placed on slides, and stained with dyes before it can be examined under a microscope. Now, the pathologist, which is the specialist that will be looking at this, may also examine cytological or cellular material. Cytologic material is present in urine, cerebral spinous fluid, which is the fluid around the brain and spinal cord, sputum, which is mucus from the lungs, peritoneal or abdominal cavity fluid, pleural or chest cavity fluid, and cervical or vaginal smears, and in fluid removed from during a biopsy. Now, once the tissues are removed, the pathologist sends a pathology report to the doctor within 10 days after the biopsy or surgery is performed. Now, in the pathology report, one of the things we want to understand about the pathology report is a few different things. So the pathology report includes these different types of things. It may contain information about the size, the shape, and the appearance of the specimen as it looks to the naked eye. The information is known as a gross description. Now remember, the pathologist is a doctor who does this examination and writes the pathology report. The pathology report plays an important role in cancer diagnosis and staging, describing the extent of the cancer within the body, especially whether it has spread, which helps determine the different treatment options that are available. Now, the things that are included in the pathology report is the patient information, which includes their name, their birth date, and the biopsy date. A gross description, which is what the color, the weight, and the size of the tissue as it's seen by the naked eye, not under the microscope. A microscopic description, which is how the tissue sample looks under a microscope and how it compares with normal tissue cells. Diagnosis, which is a type of tumor or cancer, and grade, how abnormal the cells look under the microscope, and how quickly the tumor is likely to grow and spread. Tumor size, which is measured in centimeters. Tumor margins, there are 3 possible findings when the biopsy sample is the entire tumor. So, the margins, there are 3 possible things that can happen. Number 1, the possible margin means that the positive margins mean that the cancer cells are found at the edges of the material that's being removed, which means around it there are probably more cancer cells. Negative means that there's nothing is involved, it's clear, and it's free of margins, means that there's no cancer cells are found at the edges of the sample that was taken. Close margins are neither negative or positive, but it lets them know that there possibly are other cancerous cells left behind when the tumor was removed or the tissue sample was removed. Other information usually notes about samples that have been sent for other tests or second opinions. And then the pathologist's signature and name and address of the laboratory is also in the pathology report. So when we're talking about step 4, the pathology report, we want to make sure that the person has all of those pieces, especially the staging, so that you understand clearly what's going on with that particular person. Now, step 5, after they identify the tissue as cancerous, the pathologist may perform additional tests, and those are designed to do a few different things. Before we look at that, though, I want you to understand that a little bit about tissue processing. The tissue removed during a biopsy or surgery may be cut into thin slices and placed on microscopic slides, and they're dried and frozen. Now, this is typically called a frozen section. Now, frozen sections are paraffin-embedded permanent sections. All tissue samples are prepared as permanent sections, but sometimes frozen sections are also prepared. Permanent sections are prepared by placing the tissue in fixative, usually formalin, to preserve the tissue, processing it through additional solutions, and then placing it in a paraffin wax. After the wax has hardened, the tissue is cut into very thin slices, which are placed on slides and stained. The process normally takes several days. A permanent section provides the best quality for examination by the pathologist and produces more accurate results than a frozen section. But frozen sections are prepared by freezing and slicing the tissue samples. They can be done in about 15 to 20 minutes while the patient is actually in the operating room during surgery. So these are the most beneficial when surgery is there to remove tumors so that the person can actually get the diagnosis while they're in the operating room. They can be done in 15 to 20 minutes, and frozen sections are done when an immediate answer is needed. For example, to determine whether the tissue is cancerous, so as to guide the surgeon during the course of the operation to remove more tissue, or if the margins are clear and they've got everything out. Now that we understand a little bit about the what's going on with the person and what happens during their journey, let's talk about treatment. And so the first type of treatment that we're going to talk about is surgery. And so when it comes to surgery, in theory, non-hematological or blood-involving cancers can be cured if entirely removed by surgery. But this is not always possible. When cancer has metastasized to other sites in the body prior to surgery, complete surgical excision is usually almost impossible. In the Halcyon model of cancer progression, tumors grow locally, then spread to the lymph nodes, then to the rest of the body through the lymph fluid. This has given rise to popularity of local-only treatments such as the surgery for small cancers. Even small localized tumors are increasingly recognized as possessing metastatic potential. Examples of surgical procedures for cancer include mastectomy for breast cancer, prostatectomy for prostate cancer, and lung cancer surgery for non-small cell lung cancer. The goal of the surgery can be either to remove the entire tumor of the entire organ or the entire tumor or the entire organ. A single cancer cell is invisible to the naked eye, but can regrow into a new tumor, a process called recurrence. For this reason, the pathologist will examine the surgical specimen to determine if a margin of a healthy tissue is present, thus decreasing the chance that microscopic cancer cells are left in the patient. Additionally, to remove the primary tumor, surgery is often necessary for staging, for example, to determine the extent of the disease and whether it has metastasized to regional lymph nodes. Staging is a major determinant for prognosis and the need for adjuvant therapy. Occasionally, surgery is necessary to control symptoms such as spinal cord compression or bowel obstruction. This is referred to as palliative treatment. The next type of treatment is called radiation therapy. Radiation therapy may also be known as radiotherapy, X-ray therapy, or irradiation. Now, it's used, or it's about using ionizing radiation to kill cancer cells and even shrink tumors. Radiation therapy can be administered externally via external beam radiotherapy, which is EBRT, or internally via brachytherapy. The effects of radiation therapy are localized and confined to the region being treated. Radiation therapy injures or destroys cells in the area being treated, which is the target tissue, by damaging their genetic material, making it impossible for these cells to continue to grow and divide. Although radiation damages both cancer cells and normal cells, most normal cells can recover from the effects of radiation and function properly. The goal of radiation therapy is to damage as many cancer cells as possible while limiting harm to nearby healthy tissue. Hence, it is given the many fractions, allowing healthy tissue to recover between fractions. Chemotherapy is a treatment of cancer with drugs. These are also known as anti-cancer drugs. They can destroy cancer cells. In current usage, the term chemotherapy usually refers to cytotoxic drugs which affect rapidly dividing cells in general. In contrast with targeted therapy, chemotherapy drugs can interfere with regular cell division and in different ways. For example, they can interfere with the duplication of DNA or the separation of newly formed chromosomes. Most forms of chemotherapy target all rapidly dividing cells and are not specific to cancer cells. Although some degree of specificity may come from the inability of many cancer cells to repair DNA damage, while normal cells generally can, hence, chemotherapy has the potential to harm healthy tissue, especially those tissues that have a high replacement rate, such as the intestinal lining. These cells usually repair themselves after chemotherapy. Because some drugs work better together than alone, 2 or more drugs are often given at the same time. This is called combination chemotherapy. Most chemotherapy regimens are given in a combination. The treatment of some leukemias and lymphomas are required to use a high dosage chemotherapy and total body irradiation. This is called TBI. This treatment ablates the bone marrow and hence the body's ability to recover and repopulate the blood. For this reason, bone marrow or peripheral blood stem cell harvesting is carried out before the ablative part of the therapy to enable rescue after the treatment has been given. This is known as autologous stem cell transplantation. Some other treatments that we're going to look at are called targeted therapies. Now, targeted therapies became available in the late 1990s, and they've had significant impact in the treatment of some types of cancers, and it's currently at the top of different types of research at this point. This constitutes the use of agents specific to the deregulation protein of cancer cells. So small molecules targeted therapy drugs are generally inhibitors of enzymatic domains of mutated, overexpressed, or otherwise critical proteins within the cancer cell. Prominent examples are the tyrosine kinase inhibitor cells. Monoclonal antibody therapy is another strategy in which the therapeutic agent is an antibody which specifically binds to proteins on the surface of cancer cells. Now, targeted therapy can also involve small peptides as homing devices, so to speak, which can bind to cell surfaces and act as receptors or affected extracellular matrix surrounding the tumor. Radionuclides, which are attached to these peptides, eventually kill the cancer cell if the nuclide decays in the vicinity of the cell. And this can lead to enhanced tumor specificity and avidity. So immunotherapy refers to a diverse set of therapeutic strategies designed to induce the patient's own immune system to start fighting back. Now, contemporary methods for generating an immune response against tumors include intravesical BMG immunotherapy for superficial bladder cancer and the use of interferons and other cytokines to induce an immune response to renal cell carcinoma and melanoma patients. So cancer vaccines to generate specific immune responses are the subject of intense research for several reasons and for several different types of tumors, notably malignant melanoma and renal cell carcinoma. Hormonal therapy is also another form of treatment. And this particular type of treatment causes the growth of some cancers may be inhibited by providing or blocking certain hormones. Common examples of hormone-sensitive tumors include certain types of breast and prostate cancers. Blocking estrogen or testosterone is often an important additional treatment in certain cancers. Administration of hormonal agents or agonists, such as progesterone, may be therapeutically beneficial in treating different types of cancers. The last form that we're going to look at is angiogenesis inhibitors. Now, anti-angiogenesis drugs only target one factor, so the other factors continue to stimulate blood vessel growth. Now, this is also intense area of research as well. So some, such as some different types, have been approved and are in clinical use already. One of the main problems with anti-angiogenesis drugs is that many factors stimulate blood vessel growth in cells, normal or cancerous. So anti-angiogenesis drugs only target one factor. So the other factors continue to stimulate blood vessel growth. Other problems include route of administration, maintenance or stability, and activity and targeting at the tumor's vasculature. So now that you have some understanding of the journey that people go through, the different types of cancer treatments that are available for them, I encourage you to, if this is a part of the type of health coaching you want to be able to place in your practice, it's important to have an idea about what's going on in the person's body and how it affects them overall.